Welcome to another episode of the Better Dental Life podcast. My guest today is Dr. Diana Nguyen. She is the chief of the Division of Clinical Dentistry at UCSF. She has kind of had a history in private practice and a residency at Yale. She graduated from NYU. We're excited to have her on the show to talk about her experiences in dentistry as well as what dental students are facing today and their fears and expectations as they get into clinical practice. Dr. Nguyen, welcome to the show.
Thank you, Dr. Davis. It's great to be here.
Yeah, I would love to just start. My listeners always like to get to know my guests. And so I'd love to start with just asking you why dentistry, why you picked dentistry, how you got into that.
Oh, that is a great question. So I am not like other dentists who had a dentist in the family. I'm the first one. And so my father was an anesthesiologist working at a major medical center in New York City for a very, very long time. And so I grew up in a household that really valued healthcare, and I got to see, the work that he did in terms of like saving people's lives and how dedicated he was to his patients. And so that was something that I really admired growing up. But I also saw that his schedule was very demanding, grueling hours. He missed a lot. He missed holidays, birthdays, uh, parent-teacher conferences. My teachers thought that my mom was a single mom for a very long time until at one point, I mentioned that, I was doing something with my dad and they said, oh, we've never seen him. So, and so I think that inspired me to look for something in healthcare that would allow me to have a little bit more work-life balance, a little bit more flexibility, and just to be more present with my family, because that's something that was very important to me as well.
Yeah, I love that. So tell me about your family. What's your family life like now?
Right now. So I'm married to one of my dental school classmates, and we have a 5-year-old son. His name is Henry, and he is very, very active. And he looks like daddy, but he inherited mommy's personality, which is just karma from the universe.
Yeah, perfect. Now, so you both went to school at NYU, then you graduated together?
Yes. So
Oh, and then you had a residency at Yale. Tell me about that. What was your residency like?
intense. It was probably the one of the best decisions I could have ever made in terms of investing in myself and investing in my career. I went to NYU and had an incredible experience there in terms of clinical experience and preparation for practicing dentistry. But even then, I knew that that still wasn't going to be enough for treating the types of patients that I wanted to see after graduation. I wanted to be able to do more advanced procedures. I wanted to treat more medically complex patients. And so I matched into Yale, which is a level 1 trauma center and is also a major cancer center. It's located in New Haven, which is a really interesting city to live and work in. It's home of Yale University, so there's very bustling student academic life there too. And so I spent a year treating Yale students, professors, and New Haven's homeless population, uh, and very, very sick, very, very deserving cancer patients at the Smiley Cancer Hospital as well. So that was a really wonderful experience for me.
Oh, wow. And then, so now you're across the country. How did you get to San Francisco? How did that journey take place?
I will try to condense this as much as I can because it's a long and kind of
So
winding
did
road. So as I mentioned before, I met my husband in dental school. We were classmates, met during orientation, and then we got engaged in our 4th year and then married during our residency year. So my husband did the Navy HPSP scholarship, so the Navy paid for dental school for him, and in return, he owed them 4 years uh, of service as a Navy dentist. And so after we both finished our residencies, he did an AADD and I did a GPR. The Navy sent him to San Diego. So we were very lucky to spend the first 4 years, 5 years of married life in San Diego while he was a Navy dentist. And then I worked in private practice in a variety of different practice environments in Southern California.
Perfect. So tell me a little bit about being a mom and a dentist. I have a ton of respect for women in dentistry and moms that are working. It's got to be incredibly hard. So how did you navigate that, being a mom and practicing at the same time?
It's not going to be terribly original for me to say this, but it's a huge juggling act, and I'm still figuring it out along the way. But it also is in many ways one of the most rewarding things that I've ever done. I always wanted to have a family. I always knew that I wanted to have children, and we're uh, lucky enough to um, have had our son when my husband was finishing his specialty residency um, in endodontics. And so we had him right as he was graduating from endo, and then decided to stay in San Francisco.
So you're making it work. That's perfect.
Yes. So it is hard balancing act. We are living here in San Francisco without immediate family or anyone that we can you know call in terms of support for a date night or
Right.
for last minute childcare. And so it can be difficult to navigate at times because sometimes it's just the two of us up here, but uh, we're learning that to reach out to our extended family up here in San Francisco. I have a really great support system in where I work, and the friends that I've made here along the way um, in my time up in the Bay Area, and even just the neighbors in our neighborhood where we moved to a couple of years ago have been incredibly supportive and welcoming, and so I feel very blessed for that.
Yeah, I love that. Now, tell me a little bit about the lifestyle for you as an instructor and on faculty at UCSF, but also for the dental students. Maybe what's the culture like at the school?
I continue to be really amazed at how incredible our students are. So when I first got here, as I started as full-time faculty 7 years ago, and I'm just very impressed at the caliber of student that comes to UCSF. We have incredibly diverse, incredibly ambitious student population, and so the culture here is one of like the most driven, the most talented people that I've probably encountered in my career. And so I really think, and I should say this a lot, that the best part about being at the School of Dentistry is the people that are here, because they come here with the best intentions. I have a lot of students who come here because they really want to devote their lives to treating the underserved, creating more equitable access to resources and dental care, and they come here with that mission, and they grow as clinicians and scholars, and then they leave and they become leaders in their communities. And I'm constantly seeing them popping up in the news, in social media, as influencers, as inspiration to other dentists, and it's really wonderful. It's so great to see the impact that they're having. And that's the kind of environment that we have here, is one that's very supportive of dental students growing into the people that they're meant to become, people they didn't expect to become in some ways, and becoming the best versions of
Right.
themselves. So I love that.
Cool. What challenges are they facing? What are their big fears? Maybe probably two type. One, as they're in school, and as they're beginning first few years, and then I'm sure that shifts as they're getting ready to graduate. But what do you see as the big fears maybe in both of those areas when they're starting school and they're going to be students, but then also as they get close to graduate?
I think that for a lot of our learners, they've been such overachievers in their previous lives as top of their class, being the smartest, most talented person in the room wherever they go. And then kind of getting here, and it's like we nurture that, we celebrate that, but then we're also here to challenge them and turn them into doctors. And so with that comes a lot of humbling, grueling work that we put them through, because we want we want to keep our standards high. We want to make sure that we are turning out doctors that are going to provide the best care to their patients. And so I think dental school being a stressful, challenging time in their lives, that's something that a lot of students, um, you know, I don't want to say that they really struggle with it, but it can definitely be a huge transition to go from being a student who's simply accountable to your own grades and your own transcripts, to now taking care of another person and being responsible for the outcome of their care.
Oh yeah. What are students worried about when they graduate? What are they looking for? Is it a big concern finding a practice or finding the right practice? Do most of them know what they want to do? What are they feeling like?
I would say that probably half of our students, when they graduate, have an idea of like a vague idea of what they want to do. The idea of practice ownership is a goal. The idea of also having a family is a goal. The idea of being able to own a home is a goal. And but then I think the fear or the uncertainty lies in not knowing when or how that they're going to be able to do that, when so many of them are saddled with like six-figure debt, and also have so many competing obligations in terms of responsibilities to their families and to their communities. And when you have really, really big dreams, and uh, you have been in a place that has told you, since the moment you got here, that we're going to help you achieve those dreams, it's hard to leave that, right? It's hard to leave the like warm cocoon of dental school that has nurtured and supported you for so long, and to really feel like you're on your own. And so I think one of the things that they are nervous about is uh, learning to adult, essentially learning to how they're going to be able to achieve all the things that they've set out um, to achieve, and all the things on their checklist for what it means to be um, a successful practicing dentist.
Now you as you work with them in the clinic, because you get to see them quite a bit, clinically, what do you get to do? How much do you get to help them navigate that, or what role do you get to play in helping them as they figure out their future?
Being clinical faculty is probably the best job that you could have at the dental school, honestly, because you get to be present there to lead students through a lot of their firsts. I am there for a lot of first injections, first time holding a handpiece, in a patient's mouth, first extraction, first mistake. And so a lot of that is, it's terrifying, it is exhilarating, and you get to be there for those sort of light bulb over the head moments of like, oh, now what they were saying in lecture
Right.
when they talked about how this material is hydrophobic. I finally know what that means. And understanding, why isolation is so important, why you know the selection of the type of material that they're using for a particular patient is so important. You really get to see those connections being made between what they've been lectured on for years and then what they're finally applying in patient care. And I also really like being able to help students navigate sort of the soft skills of dentistry as well, which is, how do you inform a patient that they're going to lose all their teeth? And how do you inform a patient that unfortunately there's nothing more that we can do? How do you calm down a patient who uh, is upset? about, the cost of their treatment plan. How do you talk to a patient knowing that they're going to get upset, and then dial it back down and get them to a place where they're going to be guided to accept your treatment plan and trust you. So those are things that bring me a lot of joy in the work that I do, and I feel really privileged to be able to do that.
I forget because, after we've done this for a while, and as you're talking about first and the dental students doing their first procedures, I forgot what it's like to go to bed the night before and be thinking and worried about what I'm going to do the next day. The procedures are all in my head. I'm practicing them in my head. But now, after you do this for years and years and years, you forget how much you worry about the first and the procedures that you're doing. Even when they're maybe the fifth or the sixth time you do it, you still are going over those in your head. And how's this going to go? And what do I need to make this go well? So being there with the students during that kind of anxiety, that fear, and helping them feel comfortable through that must be amazing.
Yeah, it's really very rewarding. And we have a lot of fun as well. Like one of the things when I joined the faculty here, that I really set out to accomplish was that I really wanted the experience of dental school to be a positive one, because it can be in many ways a stressful, negative, challenging one, in ways that we don't have control over, but where I can help a student have a better day in clinic, or see the silver lining in what has otherwise been, not a great clinic session, or a very, humbling session where they learn something, you know uh, that's been difficult for them, where they've gotten some constructive but negative feedback, how to rise above that and how to come out stronger and better. That's really, the crux of the work that I'm trying to do.
Now you talked about students, many of them anyway have a goal of ownership at some point in a practice, but the fear of jumping right into that with the student debt and even just knowing how to run a business and all that there is associated with ownership, maybe they slide into associateship for a little while or start as associates. And I think there are a lot more opportunities right now to be associates than when I graduated, where there wasn't as many opportunities. What are students looking for if they want to be an associate for a while? Are they looking for a quick temp job till they find something better? Are they looking for a practice they can associate in and then eventually get ownership in? What do the students want?
I think we're seeing really a very wide range of what the students want. And even though the majority of students enter dental school saying, like, yes, I think I'd like to own a practice one day, they leave dental school, and then they become more informed, more savvy consumers of education, of information, and the majority of my students will say that, they want to make sure that they have explored all of their options before committing to something like purchasing a practice, like committing to even a specific location of the country. They are now choosing to do residency or choosing to do an associateship in an area of the country where they don't know anyone, and they're just going there because there's opportunity, and there's a reason to spend a couple of years in an area of the country that they've never experienced before, and they just want to see what's out there. So, and I commend them for that. I think that is really a great way to diversify your experience and the skill set that you'll be able to bring back to your patients wherever it is that you decide to settle. So a lot of students are leaving dental school and saying, you know what, I don't even know if I want to own a practice, because I don't know if I want to assume all the responsibility that comes with running a business entirely by myself, and having all the decisions come down to me. I think a lot of students are also embracing the idea of opening up practices with a partner, being part of a group practice, multi-specialty group practice, so that they can, balance those responsibilities of ownership with other people, and and not share all those burdens. Share all those burdens with other people, so that they have other team members that they can make decisions with, and people who can cover their vacations, people who can cover for them if they get sick, or you need to take time off, and have to devote their time and attention to other obligations outside of their practices and outside of being a dentist. So I think that what we're seeing now is the new dental school graduate really wants to make sure that they can continue to have a balanced life, and experiences that are aligned with what they want out of their whole life, not just out of their identity as a dentist.
Which is great. I mean, we need to have, I think, beyond that identity as a dentist, we need to have an identity as a person, whether that is, I'm an amazing father, I am an athlete and I like to go run, or whatever other things we have. We need to make that a part of our identity for sure. I think that's really valuable. I like that. Our brains, as you're talking, I was thinking about the way our brains certainty. And there is a battle we have as a human. We need to have certainty and security in our lives, and need to find that and fulfill that in some ways. And we have the need for variety and uncertainty, but our brains shy away from uncertainty, especially if we much of that. And dental school, with the firsts of procedures and always something new, I can see how having some security or some certainty with working as an associate somewhere really appealing, as opposed to the uncertainty of buying a practice or jumping into something. What feels more secure and what feels more stable for students is a DSO environment versus a private practice environment. Is there a feeling one way or the other, or does that vary as well?
I've definitely seen a lot of my students being drawn to DSOs, whether it's for the short term, they say, oh, I'm going to get my feet wet here, I'm going to launch my career at a DSO, and then see where life takes me, maybe transition over to private practice afterwards. And then there are students who are really drawn to it, and they say, no, this is the practice model that best suits my needs, and best suits my goals in dentistry and for my life. So it can be hard to pursue a career in private practice right off the bat, because DSOs are offering things like medical benefits, retirement plans. They offer pretty pretty attractive sign-on bonuses, and incentives that a lot of private practices are just not able to provide to a new graduate, or even a seasoned associate dentist who wants to join the practice. And so for a student who is graduating and saddled with huge amounts of debt, who is entertaining offers from either private practice or DSO, if the DSO is offering relocation reimbursement, and offering with tuition reimbursement, offering to provide medical, dental, vision benefits, for not for them but for their whole families, and that type of security, those types of incentives are very, very difficult to say no to when when you've got bills to pay, and you've got dreams that you hope to achieve.
Yeah. When are students making decisions? If a senior ready to graduate, have they decided and know where they're going to go in the fall, and they have the whole year to get ready for that? Or are they deciding in the spring? When are they figuring out their home after graduation?
Well, it depends on what their immediate plans are. So for the students who are interested in specializing or doing a residency of some sort, so many of them have been working towards that goal since their first year of dental school. They've been shadowing other doctors in different departments. They figured out they really want to do perio or they really want to be an orthodontist, and so they devote themselves to research endeavors, and they devote themselves to exposing themselves to more of those specialized procedures, and the doctors who are leaders in those areas of expertise. And then for those students who are doing that or interested in a general practice residency or an AGD, then they've got to apply a year ahead of time because they have it's part of a match process. Most of these programs are, and so they've got to get letters of recommendation in. They have to line up which programs they want to apply to. There's a whole application season that's just like applying to dental school. So there's months of sending in forms, being vetted, being invited to see programs, and then they find out what their results are. It There are two phases of match, one in the fall of their fourth year and one in the winter, or typically in January of the D4 year. And so they may know where they're going if they're going to residency based on the outcome of the match result that comes out in either November or January. But for students who are not planning on doing residency, then they're going to be applying for jobs either in their fall to spring of their fourth year, and or they may wait until after graduation and wait until they've got that diploma and that license in their hand to start sending out resumes to different places. But the students who know early on that they're interested in potentially signing with a DSO, the DSOs actually have they actually start, I would say, trying to scout students very early on. They seem to find their way into students' inboxes on social media and connect with them pretty early on. And so, I know that students get invited to DSO conferences. They get they're courted in many ways by these big dental service organizations to come and join and become an associate there, and to maybe see a career in a DSO pathway. And so
that starts early.
that can take place, in their second, third, and into their fourth year. I have some students who are handed contracts for DSOs at the beginning of their fourth years, and they're trying to figure out at that point if they should say yes to that, if they should do a residency, if they should just try their hand at getting a job in private practice instead. So it can be a lot to weigh the options and figure out what's right for them.
Yeah, and playing into that certainty and security, that feels nice to have an answer, and feels good to know exactly what you're doing. You have something stable. Yeah, it's going to be okay. Even if it's not your, lifelong ambition, knowing you have something can be really, really appealing. And
Right.
so, that's smart for the DSOs to be there then. And if general dentists want to reach out to students, and are interested in graduates as associates, that'd be the same time you'd want to be doing the same thing.
Exactly.
So I love what you talked about in just the rewards for you and what it's like to work there and the benefit of being there. So if somebody is interested, if dentists who are in private practice are interested in becoming faculty and getting involved in teaching, what's the path for them to find, and what type of person should look for that as a career?
So I welcome doctors from all different phases of their careers, whether they are just starting out um, in uh, in dentistry, if they've just graduated fairly recently, to doctors who are maybe thinking of retiring from private practice or wherever it is that they're working, and or doctors who are still in practice and don't want to give that up, but they want to spend a day, 2 days, working part-time or even as a volunteer at a dental school, because I think the more diverse perspectives that we can bring to our students as they're learning to become clinicians, the better they can be in terms of being able to understand that the types of patient needs and experiences that they should have when they go out and practice in the real world. If someone is interested in
So,
teaching at a dental school, there's a couple different ways that they can find out about opportunities. One is if they know specifically about the school that they want to teach at, then they should try to contact the dental school directly. If you were to contact, send an email or try to uh, uh, phone in, an inquiry to, one of our clinics, you'll be directed to someone like me, essentially. And so there are search committees and, hiring committees at every dental school that works on bringing in new faculty and talent. And so there's that direct method. And then there's also, if you go to the ADEA website, which is, the American Dental Education Association's website, they do actually have a search engine there where they list open opportunities at dental schools, even dental hygiene schools and dental assisting schools across the country. And so if you're interested in getting more involved in teaching, then that's a way that you can see opportunities on a national scale. And then if you don't live near a dental school, if you don't live or you're unsuccessful in getting through to one, another option is to look at volunteer opportunities in your community, whether it's in your in your city or your home state. Every every state has a dedicated dental society, and there's also local components to organized dentistry that will have opportunities for dentists to work as volunteer dentists in their community, and can point you in the direction of opportunities for teaching and getting involved in the learning process.
oh, that's great. Now, is there if I want to start out and I'm interested, I want to reach out to you and say, hey, I want to start. I'm interested in being on the faculty. Are there positions where you start out at? I wouldn't come in and be the dean, of course, but are there, what kind of job roles would you start out at beginning at the school?
Sure. It is just like applying to a job anywhere else. It starts off with a conversation. Our best faculty are ones that just were curious one day, and they either, had a friend of a friend recommend that they look at our dental school, or they knew someone who worked here, and they were connected to our members of our faculty who helped to bring new doctors on board. And so we started off with a conversation of like, what makes you interested in teaching, and what kind of skill set do you have, and what are your goals in coming here? So we have doctors who they have loads of experience in surgery or loads of experience um, in like consulting, and they have worked with geriatric populations, veterans, and so all of that is unique and helpful to our students. And when we think about bringing a doctor in, we think about how this person is going to be a good fit for our community, and that where they can really apply their talents and experience to best serve our students and best serve the patients that we see here.
I love it. So now just tell me a little bit more about yourself. What do you love to do for fun? I see in your background picture is and so if those that are listening on the podcast and not watching, you won't see this, but background picture is the Golden Gate. And I love San Francisco. I love to visit. I like to run as well. And one of my favorite running memories is when a friend of mine and I, Aaron Tinkle, another dentist up in Portland area, we were at a meeting and we wanted to go for a run, and we planned it, took off and ran across the Golden Gate to the other side and back. And it was just like, I'll never forget that. So I love San Francisco. What do you love to do in San Francisco? What are your favorites?
My husband and I are actually really big foodies, and we love to entertain as well. So we really enjoy, trying out new recipes. And one of the really great things about living in the Bay Area and where we are in the Bay Area is that we're actually so close to wine country. And so it's great for us to be able to just, like, on a whim, just when we're bored, we drive up to Napa and try out a new restaurant, or check out a farmer's market. I really, I live for those sort of very simple things. I'm like, oh, I heard that there's this really good rotisserie chicken truck at the farmer's market in
The
Napa.
food there in San Francisco is amazing. So you've got a lot of choices.
Right, right. And so that's the sort of thing that we devote our weekends to, is very simple, um, simple pleasures uh, and agendas. And so also having a 5-year-old also makes it fun too, because we're there as he's discovering the world and discovering new experiences too. And so that takes up a lot of my time as well.
I love it. Well, thank you so much for coming on the podcast. I've loved speaking with you. I learned a lot about what's going on in talking to you about your experience as faculty member and director there at UCSF. If somebody wanted to reach out to you, and how would they do that? If they were interested in faculty position or wanted to learn more about the school, how could they get a hold of you?
I'm on LinkedIn. If you're interested in a faculty position, want to talk to me more about it. I'm also on Instagram. So, so if people want to reach out to me there, they can find me. I'm at Diana on Instagram, and so I'm happy to talk more about you know, the dental school, about becoming faculty, about the transition from private practice to academia. And so I'm definitely interested in connecting more with your listeners and anyone out there who is just curious about it.
I love it. Thank you so much. Been an absolute pleasure. So appreciate you coming on the show and talking with us today.
Okay. Thank you so much. It was really great.